Bismillahirrahmanirrahim. Assalamu alaikum. So today's ECG, we start with the rhythm by looking at the P wave in lead 2. There is a P wave in the lead 2, but look at the morphology. It is the not normal morphology of the P wave. Usually the P wave is upwards in all the leads except lead AVR, but here you can see that we have an inverted P wave, which is showing that this is not originating from the SA node, rather it has a ectopic foci but in the atrium. So then after commenting on the rhythm, we calculate the rate by counting the number of boxes between the two R waves, which are 1, 2, 3, 4 in this case. So we divide 300 with 4 and we can get the rate, which is about 60 to 70 beats per minute in this case. The other thing that we note is both lead 1 and AVF are upwards, the QR's complexes are upwards, so this is a normal axis. Then we start looking at the PR interval, QRS complexes, ST segment and the T wave or any abnormal wave in all the leads. So here these are normal in lead 1, lead 2, lead 3 and lead AVR, lead AVL. Here you can see upward P wave in AVR, which is not usually the case. Okay, and then we have the normal things in the AVL, and AVF is normal. Also in V1, no ST segment depression, elevation, and we have the R wave originating in the lead 2 when it is progressing normally, so normal progression of the R wave, no W or M pattern in lead V1 or V6. So the total assessment of the ECG is that this is a ectopic atrial rhythm. Otherwise the ECG is normal, but the thing is that you have to concentrate that whenever you find the P wave of this morphology, this is actually originating in the atrial muscle rather than the SN node, hence the abnormal P wave. And but sometimes you can also notice, and in this ECG also you can notice that there is a slight short PR interval, and so here we can also comment in general that this is a abnormal P wave with slightly short PR interval, but the total assessment is that it is a ectopic atrial rhythm most probably. And you should know that this rhythm is not uncommon, and it is usually of no clinical significance. And what we have to do, that we have to take a careful history, and we have to determine that whether the patient is having any symptoms of palpitations or associated symptoms like breathlessness or any precipitating and terminating factors of palpitations. And if we have any doubt in the history, or that is and the patient is having symptoms, so we can go for ambulatory recording of the ECG, which is also termed as the Holter's monitoring. Thank you.